You know, the interesting thing about technology is that the more we use it, the more it becomes a part of us, and the more we become a part of it. Technology is everywhere. Do you have a smartphone? Most people say yes. Do you want your life to be easier? Most people say yes. The thing about these interesting pieces of technology is that you can do many things with them, and it fits in a pocket or a purse. So it'll keep you organized, it'll help you remember things. When you're not sure the answer to something, it'll help you find that answer, and even entertain you when you're a little bit bored. Thank God for Netflix. Paul Jerry, Graduate Center for Applied Psychology, Athabasca University. And a lot of the work that I'm doing right now in terms of research and writing is around the ethical integration of technology in clinical practice. So you have one of these sitting in your pocket or your purse, and you'd like to use it as a piece of technology to help make your clinical life easier. Well, one of the arguments that I'm currently making is that the use of technology is actually a clinical competence in the same way that understanding a particular therapeutic technique or knowing how to do a particular procedure is also a clinical competence. If we don't know how to use these devices, we have the potential to put clients or patients at risk. We have the potential to lose important information or data that is necessary for appropriate and ethical care. And we have the potential to cause damage to the profession by the inappropriate use of this kind of technology. The questions that I'm currently looking at, trying to find answers for, or at least guidance for, is how to integrate technology as a competence in clinical practice through the use of ethical reasoning and decision-making models. So some of the writing that I'm currently working on is asking the question and trying to find the answer to, if I want to use this as my main device for keeping track of my clients, what do I need to think through? Some of the interim conclusions that I've come to as a result of exploring these areas suggest to me several things. First of all, the use and integration of technology in clinical practice is inevitable. We already use these every day all the time. Clinicians simply transition into their clinical lives the use of these things every day all the time. The second thing that I'm discovering is that the ethical codes and the decision-making models that exist for many health professions are in fact equipped to handle the integration of a new technology. Because if we frame this as a competence, then it really is no different than integrating a new clinical technique. Lastly, the research that I'm doing suggests that the integration of technology is actually predictable, and that people do go through reasonably robust stages of finding a technology, asking the questions about how it can be used, experimenting and working with it. So that's just a brief glimpse into one of the areas that I'm working in. Once again, Dr. Paul Jerry, Graduate Center for Applied Psychology, Athabasca University. Thanks for your attention.